Limbic-predominant age-related TDP-43 encephalopathy, or LATE, is a neurodegenerative condition that mimics Alzheimer's disease but is caused by a different underlying process. It primarily affects older adults and is associated with the buildup of an abnormal protein called TDP-43 in the brain. LATE leads to progressive cognitive decline, particularly affecting memory and reasoning abilities. Because it shares many symptoms with Alzheimer's disease but requires different diagnostic approaches and management strategies, understanding LATE is crucial for both patients and caregivers. In this video, we'll explore what LATE is, how it affects the brain, its symptoms, how it's diagnosed, and what can be done to manage the condition. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. LATE is a type of dementia that primarily affects the limbic system of the brain, including areas like the hippocampus, which is critical for memory formation. Unlike Alzheimer's disease, which is characterized by the accumulation of amyloid plaques and tau tangles, LATE is associated with the misfolding and accumulation of TDP-43, a protein that normally plays a role in regulating gene expression within nerve cells. When TDP-43 becomes misfolded, it can no longer function properly, leading to neuronal damage and loss. This process is especially pronounced in the hippocampus and other regions responsible for memory and emotional processing. The result is a progressive decline in cognitive abilities, much like what is seen in Alzheimer's disease. LATE is often found in individuals over the age of 80 and can coexist with other neurodegenerative conditions, including Alzheimer's. This overlap makes diagnosis challenging, as traditional biomarkers for Alzheimer's may not reveal the presence of LATE. The symptoms of LATE closely resemble those of Alzheimer's disease, but there are some key differences. The most prominent early symptom is memory impairment, particularly difficulty forming and retaining new memories. Patients may forget recent conversations, struggle to recall events, or repeat the same questions within a short period. As the disease progresses, individuals may experience difficulties with language, including trouble finding the right words or following conversations. Unlike Alzheimer's, where early language impairment is less common, LATE often presents with more gradual speech difficulties over time. Another characteristic symptom is impaired reasoning and decision-making. Patients may struggle with problem-solving, managing finances, or making sound judgments in everyday situations. They may also have trouble with spatial awareness, leading to difficulties navigating familiar places or recognizing faces. Behavioral and emotional changes are also common. Some individuals with LATE experience apathy, depression, or anxiety. They may withdraw from social activities, show a lack of motivation, or display increased irritability. Unlike some other forms of dementia, LATE does not usually cause severe personality changes or early hallucinations, which are more characteristic of conditions like Lewy body dementia. In later stages, the disease leads to a more severe cognitive decline, loss of independence, and difficulties with daily activities such as dressing, eating, and personal hygiene. Because LATE primarily affects the limbic system, emotional regulation may also become more challenging. Diagnosing LATE is difficult because it mimics Alzheimer's disease and other forms of dementia. Currently, there are no specific blood tests or imaging techniques that can definitively diagnose LATE in a living person. Instead, diagnosis is often based on clinical assessment, neuroimaging, and in some cases, post-mortem brain analysis. A comprehensive clinical evaluation includes a detailed medical history, cognitive testing, and neurological examination. Doctors assess memory, language skills, reasoning abilities, and other cognitive functions to look at patterns consistent with LATE. Because LATE progresses more slowly in its early stages than Alzheimer's, tracking symptoms over time can provide important diagnostic clues. Brain imaging, such as MRI scans, may be used to rule out other causes of cognitive decline, such as strokes or tumors. In some cases, MRI findings may show shrinkage in the hippocampus, similar to Alzheimer's disease. However, LATE does not typically show the same level of amyloid plaques and tau tangles seen in Alzheimer's, which can help distinguish between the two conditions. Positron emission tomography scans that detect amyloid and tau proteins may be useful in ruling out Alzheimer's disease. If a person has dementia symptoms but does not show amyloid or tau buildup on a PET scan, LATE becomes a more likely explanation. Ultimately, a definitive diagnosis of LATE can only be confirmed through brain tissue analysis after death. However, ongoing research is working to develop biomarkers and imaging techniques that may allow for earlier detection in living patients. There is currently no cure for late, and treatment focuses on managing symptoms, improving quality of life, and supporting patients and caregivers. While some medications used for Alzheimer's disease may offer limited benefits, they are not specifically designed to target the underlying mechanisms of late. Cognitive symptoms such as memory loss and language difficulties may be managed with certain medications. Cholinesterase inhibitors such as donepezil or rivastigmine are commonly used in Alzheimer's disease and may provide some cognitive benefits in late as well. However, their effectiveness is not well established for this condition. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics or questions you want covered in future videos. Anyway, non-medication approaches play a crucial role in managing late. Cognitive therapy, structured routines, and memory aids can help individuals maintain function for as long as possible. Caregivers can assist by simplifying daily tasks, using calendars and reminders, and maintaining a consistent environment to reduce confusion. Physical activity has been shown to support brain health and slow cognitive decline. Regular exercise, even light activities such as walking or stretching, can help maintain mobility and improve overall well-being. Social engagement is also important. Maintaining social connections through family visits, support groups, or community activities can help reduce feelings of isolation and depression in individuals with late. Behavioral and emotional symptoms such as anxiety or depression may be treated with counseling or medication. Antidepressants and anti-anxiety medications can be used cautiously, as some may have side effects that could worsen cognitive symptoms. Caregiver support is a critical aspect of late management. As the disease progresses, caregivers often face increasing challenges in providing care, managing behavioral changes, and ensuring safety. Support groups, respite care, and professional caregiving services can help alleviate the burden and provide guidance on coping strategies. Late is a relatively newly recognized condition, and research is ongoing to better understand its causes, risk factors, and potential treatments. Scientists are studying how TDP-43 accumulation leads to neurodegeneration and exploring possible therapeutic targets. One area of interest is the development of biomarkers that can detect late in living patients. Blood tests, cerebrospinal fluid analysis, and advanced imaging techniques may one day allow for earlier and more accurate diagnosis. Potential treatments targeting TDP-43 accumulation are also being explored. Researchers are investigating ways to prevent TDP-43 from misfolding, clear toxic protein deposits, or protect neurons from damage. While no disease-modifying treatments are available yet, advances in neurodegenerative research offer hope for future breakthroughs. Late is a challenging and often underdiagnosed condition that mimics Alzheimer's disease but has distinct underlying mechanisms. It primarily affects older adults and leads to progressive memory loss, language difficulties, and impaired reasoning. Because late is difficult to diagnose and has no specific treatment, management focuses on symptom relief, cognitive support, and caregiver assistance. Ongoing research is working towards better diagnostic tools and potential treatments for late. Understanding this condition is essential for both patients and caregivers, as it can help with planning, adapting to cognitive changes, and ensuring the best possible quality of life. If you or a loved one is experiencing memory problems or cognitive decline, speaking with a healthcare provider is an important step toward getting the right diagnosis and support. As research continues, there is hope that new advancements will lead to earlier detection and more effective treatments for late and other forms of dementia. Thank you for watching. As always, take care of yourself and make the most of your day.